Oh, the Soviets launched Sputnik first? What? There's a second Red Scare? Whoa, whoa, you guys, enough already. Why don't we all just stay cool? This is the end of the drive-in, baby. Fast food, muscle cars, James Dean. And here, at the Carpe Drive-In, we don't gab about the Cold War, we grab a cold one instead. Our motto? Seize the night. This video marks the second entry in our series on anti-epileptic medications. Recall that in our last sketch, where we were lucky enough to score tickets to Shaking Man Festival, we dusted off a number of broad-spectrum anticonvulsant medications used for all types of seizures, including focal with secondary generalization, and a whole load of generalized seizures. In this sketch, we'll be introducing some narrow-spectrum anti-seizure medications. Most of these agents will be effective against focal seizures and focal seizures with secondary generalization. To emphasize focal seizures here at the drive-in, notice how this waitress suddenly realizes how paradoxically inefficient it is to wear roller skates while delivering fast food, and reaches out one arm to catch her balance. Let this focal, uncontrollable shaking represent the narrow-spectrum anti-epileptic agent's ability to treat focal seizures. I want to emphasize, however, that although some of the following agents can be used to treat generalized tonic-clonic seizures as well, they should be avoided in other generalized seizure disorders, including juvenile myoclonic epilepsy, or JME. They can actually exacerbate seizures in these patients. Oh, here comes our first customer of the night. Let this classic car remind you of the classic narrow-spectrum anti-epileptic agent, carbamazepine. While carbamazepine used to be considered a drug of choice for focal and generalized tonic-clonic seizures, it is now being replaced by the newer broad-spectrum agents. Remember that this classic drug is ineffective against absence seizures and should be avoided in other generalized seizure disorders such as JME. Carbamazepine works by binding to voltage and use-dependent sodium channels. This binding extends the inactivated phase. It's kind of like these salty sodium chip bags tumbling to the ground as our waitress reevaluates the utility of skates when delivering food. An open sodium chips bag is kind of like an open activated sodium channel. Shortly after depolarization, an inactivation gate swings shut, only resetting after the neuron is repolarized. That inactivation gate, then, is kind of like the clip on the salty sodium chip bag, holding it shut. By prolonging the inactivation phase of sodium channels, carbamazepine blocks the sustained high-frequency firing of neurons. Although newer anti-epileptics may be preferred for treating those focal and generalized tonic-clonic seizures, carbamazepine is still your first-line agent for the treatment of trigeminal neuralgia. Trigeminal neuralgia presents with episodes of sudden and severe pain in the distribution of CN5, particularly V2 and V3. At Sketchy, we symbolize the trigeminal ganglia with 3 gems, naturally. And in this scene, these gems are pretty electrifying, lighting up the night from that neon sign. The pain associated with trigeminal neuralgia is described as stabbing, or like an electric shock. It's usually unilateral and won't last for more than a few seconds, though it does occur repeatedly. Pain is triggered by any stimulus to CN5, and this can include chewing, brushing teeth, shaving, swallowing, and the pathogenesis remains unclear. Carbamazepine is one of your go-to agents for initial pain control, reducing pain in over 80% of patients. Note that oxcarbazepine, which we'll explore later in this sketch, is preferred by some experts for trigeminal neuralgia due to better tolerability and fewer drug-drug interactions than carbamazepine. Carbamazepine may be poorly tolerated. It is associated with an extensive side effect profile, and many reactions are quite serious. The most common dose-related adverse effects of carbamazepine are diplopia and ataxia. Let this absurdly tall stack of patties, toppling over as our waitress here unsteadily approaches the car, represent that central ataxia and unsteadiness. This is especially important to keep in mind in older patients who may tolerate higher doses poorly and are at an increased risk for falls. Dizziness and unsteadiness may be most pronounced when initiating therapy or increasing the dose. The use of controlled-release tablets can reduce these peak concentration-related adverse effects. Diplopia often occurs first, and it's highlighted here by the misaligned headlamps. Ooh, that is very awkward. A water cup to the head? At Sketchy, that can only mean one thing. Excess free water retention caused by inappropriate amounts of antidiuretic hormone, ADH, or vasopressin for some folks. That's a syndrome of inappropriate antidiuretic hormone secretion to you, Daddy-O, a rare side effect of carbamazepine. This phenomenon is due at least in part to increased responsiveness of collecting tubules to antidiuretic hormone, creating a dose-related hypoatremia that develops gradually over the first few months of therapy. Idiosyncratic blood dyscrasias are some of the most concerning adverse effects associated with carbamazepine use. Leukopenia occurs in approximately 12% of children and 7% of adults. It may be transient or persistent and does not usually require immediate discontinuation of carbamazepine therapy. However, fatal aplastic anemia and agranulocytosis can occur, most likely within the first 3 or 4 months after initiating therapy. Agranulocytosis, specifically, is illustrated here at the drive-in by this sand timer with the falling granules, meant to evoke an image of the falling levels of granulocytes in the setting of bone marrow suppression. White blood cell counts less than 3,000 per microliter or neutrophil counts below 1,000 per microliter warrant either a decrease in carbamazepine dose with frequent white blood cell monitoring or drug discontinuation. Carbamazepine is also contraindicated in people with a history of bone marrow depression. Drug interactions involving carbamazepine are almost exclusively related to the drug's hepatic enzyme-inducing properties. See that CYP450 license plate attached to that chrome bumper? Let it remind you that carbamazepine is a potent broad-spectrum inducer of the cytochrome P450 system in the liver, namely CYP2B6, CYP2C9, and CYP3A4/5. This induction increases the metabolism of numerous substrates, including warfarin and other anti-seizure agents, leading to potential undertreatment due to the reduced drug serum levels. Carbamazepine can also cause a rare, potentially life-threatening drug reaction with eosinophilia and systemic symptoms, or DRESS syndrome. It can occur 2 to 6 weeks after exposure with symptoms of fever, generalized lymphadenopathy, facial edema, and a diffuse mobiliform skin rash. And since lab studies show eosinophilia, we've sketched in this DRESS with eosinophilic spots. It can affect the liver, kidneys, and lungs with the potential for hepatic or renal failure. Stopping carbamazepine and beginning treatment with corticosteroids usually results in symptom improvement. Carbamazepine should not be restarted. Carbamazepine has also been associated with major fetal malformations. As always, whenever we want to remind you of teratogenicity, we'll sketch in that teratogenic tarantula, this time incorporated into the cool leather jacket of this greaser over here. Stay gold, ponyboy, stay gold. Many anticonvulsants appear to be implicated in fetal dysmorphisms, such as hypoplasia of the nails and distal phalanges, hypertelorism, and characteristic facial features, including a broad nasal bridge, long upper lip, and maxillary hypoplasia. Let this long, bent, neural tube-like exhaust remind you of carbamazepine's specific association with neural tube defects, spina bifida in particular. Stylish-looking wheel. Looks a lot like a contraceptive pill packet. Well, due to carbamazepine's ability to induce CYP3A4, hormonal contraceptive efficacy can decrease due to increased metabolism of the estrogenic and progestogenic components of oral contraceptives, both of which are CYP3A4 substrates. This includes combined oral contraceptives, combined hormonal vaginal rings, oral progestogen-only contraceptives, etenogestrel implants, as well as ulipristal for emergency contraception. A copper IUD, levonorgestrel IUD, or medroxyprogesterone depot, all of which are unaffected by CYP3A4 induction, should be considered instead. Lastly, carbamazepine has been associated with Stevens-Johnson syndrome and toxic epidermal necrolysis, or SJS-10. Most cases occur during the first 8 weeks of therapy. Our recurring sketchy symbol for SJS is a red mask getting removed, depicting the classic sloughing rash that incorporates mucous membranes. Looks like this greaser was doing masks before it was cool. This possibly fatal reaction is significantly more common in patients with the HLA B1502 allele, which occurs almost exclusively in people of Asian ancestry. Screening for this allele in patients with Asian ancestry, especially Han Chinese, Thai, and Malay, is recommended prior to starting carbamazepine, If the test is positive, avoid use of carbamazepine if possible. Next, we have oxcarbazepine, symbolized by our rival Oxcar hot rod. Oxcarbazepine is used for the management of focal seizures, either as adjunctive treatment or monotherapy in both children and adults. The efficacy of oxcarbazepine is comparable to carbamazepine and other first-line therapies for focal and secondarily generalized tonic-clonic seizures. Like carbamazepine, this drug lacks efficacy against absence seizures and myoclonic seizures, and can even increase the risk of these seizures occurring. Underneath the Oxcar wheels is a bag of salty sodium chips. Like carbamazepine, oxcarbazepine works by blocking voltage-dependent sodium channels. This binding inhibits repetitive neuronal firing and reduces seizure spread within the brain. One of the benefits of oxcarbazepine over carbamazepine is fewer CNS side effects and less likelihood of drug-drug interactions, and therefore may be a suitable alternative for patients unable to take carbamazepine. See our helmet on the Oxcar driver, providing protection to his brain, symbolizing the reduced CNS side effects of oxcarbazepine. And note the tinted windows on the Oxcar, allowing for fewer interactions, just like the fewer interactions experienced with oxcarbazepine compared to carbamazepine. However, it does come with some adverse effects that are also associated with carbamazepine, from common side effects like diplopia and ataxia to more serious side effects like Stevens-Johnson syndrome, blood dyscrasias, and DRESS. People with the HLA B1502 allele are also at a greater risk of SJS, just like with carbamazepine. Like carbamazepine, oxcarbazepine has been associated with major fetal malformations, like oral clefts and cardiac malformations, and should therefore be avoided whenever possible. Alright, on to our next narrow-spectrum antiepileptic agent, phenytoin, one of the oldest anti-seizure drugs around. This classic drug will be represented here by this classic phenytoin tow truck, called to the drive-in because of all the ruckus caused by these greaser hoodlums. Just like carbamazepine, this drug used to be a first-line agent for focal and generalized tonic-clonic seizures, but is now being replaced by the newer broad-spectrum drugs. Phenytoin is also ineffective against absence seizures and should be avoided in other generalized seizure disorders, such as JME. Like carbamazepine and oxcarbazepine, phenytoin prolongs the inactivation of sodium channels and blocks the sustained high-frequency firing of neurons. So again, on the ground, next to the tow truck, we've strewn more of these inactivated salty sodium chip bags, complete with those inactivating clips. The side effects of phenytoin therapy are similar to those caused by other agents in this group. Ataxia will once again be represented by the unsteady hands of one of those roller skate waitresses, causing that tall stack of hamburger patties to topple over. Other common dose-related adverse effects include diplopia and nystagmus, highlighted here by the misaligned headlamps. Gingival hyperplasia is known to occur in at least 50% of patients who have had 3 to 4 months of phenytoin therapy. Expanding gums, just like this expanding bubble gum here. The mechanism is associated with an increased expression of platelet-derived growth factor, leading to proliferation of gingival cells and alveolar bone. Hirsutism also occurs to some degree in most patients, as well as coarsening of facial features, hence the coarse facial hair. This can be especially unpleasant for some people. Not for him, though. I like the cut of his jib. So rugged. Anticonvulsants such as carbamazepine, oxcarbazepine, and phenytoin are also associated with a drug-induced lupus syndrome. So, as a little reminder, we've included our recurring sketchy symbol, a lupus wolf, the tow truck driver's trusty companion. Have you ever tried arguing with a tow truck driver who's accompanied by a wolf? Like with carbamazepine, phenytoin can also cause a rare, potentially life-threatening drug reaction with eosinophilia and systemic symptoms, or DRESS syndrome. And to convey eosinophilia, we've sketched in this dress with eosinophilic spots. Patients can develop a rash with phenytoin, and if you do, you're also more likely to develop one with carbamazepine and oxcarbazepine. Phenytoin has been associated with Stevens-Johnson syndrome and toxic epidermal necrolysis, particularly during the first 8 weeks of therapy. As with carbamazepine and oxcarbazepine, this potentially fatal reaction appears to be more common in patients with the HLA B1502 allele, which occurs almost exclusively in patients of Asian ancestry. Our recurring sketch symbol for SJS, of course, is a red mask getting removed, depicting the classic sloughing rash that incorporates mucous membranes. Phenytoin has also been associated with major fetal malformations. As always, whenever we want to remind you of teratogenicity, we'll sketch in that teratogenic tarantula. Again, it's incorporated into the cool leather jacket of one of those outsiders. Orofacial clefts, cardiac malformations, and genitourinary defects are the most commonly described malformations. Also, you see that CYP 450 license plate attached to that chrome bumper? Like carbamazepine, phenytoin is a potent broad-spectrum inducer of the cytochrome P450 system in the liver, increasing the metabolism of numerous substrates, including warfarin and other anti-seizure agents. Like carbamazepine, phenytoin induces CYP3A4 and can therefore decrease hormonal contraceptive efficacy. Our recurring sketchy symbol, the contraceptive pack, now a tumbling hubcap from the phenytoin tow truck, should help you remember this. A copper IUD, levonorgestrel IUD, or medroxyprogesterone depot, all of which are unaffected by CYP3A4 induction, should be considered. Phenytoin is also associated with altered bone and mineral metabolism and decreased bone density. I mean, look at that porous, fractured axle. This is related in part to the induction of cytochrome P450 enzymes, as well as increased vitamin D catabolism. Calcium and vitamin D supplementation, as well as bone mineral density testing, are suggested in patients on chronic therapy, especially elderly patients. Pop quiz! A patient suddenly develops sustained, generalized tonic-clonic convulsions for 30 minutes without fully regaining consciousness between episodes. He's urinated, he's biting his tongue. What do you do next? First of all, you need to recognize that this is status epilepticus, and that's why we've included this order status display in front of the diner. Clinicians define status epilepticus as seizures that have continued for more than a few minutes without recovery in between. This is a life-threatening emergency requiring immediate cardiovascular, respiratory, and metabolic management plus pharmacologic therapy. A benzodiazepine, such as diazepam or lorazepam, is the most effective agent available for stopping the attacks, and it's usually given by direct IV administration. So when your order is up, head over to Ben's Diner, our recurring setting for all that is benzodiazepines. Check out our Lego My Benzo sketch for more info about benzodiazepines. Once status epilepticus is initially controlled, maintenance therapy usually consists of IV phenytoin or fosphenytoin, so the phenytoin tow truck is oriented under the order status sign as well. Patient not responding to benzos or phenytoin? Start IV phenobarbital. High doses of phenobarbital will control almost any seizure, but at the cost of substantial sedation and potential reduction of blood pressure and respiration, so watch out. Our recurring theme for barbiturates, like phenobarbital, is a barbershop, of course like this one. Phenobarbital and the related barbiturate primidone have classically been used to treat focal and generalized tonic-clonic seizures, but their use has been largely supplanted with less sedating agents. Check out our barb shop sketch for more info. Let's wrap up this scene with two anti-seizure medications that affect GABA transmission. At Sketchy, GABA is symbolized by the GABA cab, or Cab A, and over across the street from the diner is the local repair shop, where the Cab A is getting a lift, if you will. Let me show you what I mean. Vigabatrin is an irreversible inhibitor of GABA transaminase, the enzyme responsible for the degradation of GABA. This produces a sustained increase in the concentration of GABA in the CNS, providing tonic inhibition. Transaminase kinda sounds like transmission. So just think of this vigabatrin cab transmission that's broken down, now getting fixed by the repairman, kind of like inhibiting the breakdown of GABA, right? On the other hand, tiagabine is an inhibitor of GABA uptake, prolonging the inhibitory action of synaptically released GABA. So instead think of this tiagabine necktie getting caught in the cab, preventing it from being taken up. Both these medications increase GABA concentrations in the CNS and can be used as an adjunctive treatment for focal seizures. Well, that about wraps it up. Remember, carbamazepine, oxcarbazepine, phenytoin. These are your narrow-spectrum anti-seizure medications. They do not provide much use for treating absence seizures. Keep watching because in our next sketches, we're going to explore more anti-seizure drugs, including ethosuximide, gabapentin, and pregabalin. Well, I better head out Stay gold, Ponyboy, stay gold.